Hello and welcome back to my channel. Today we're going to talk about a condition that affects nearly 1 in every 3 people at some point in their lives, shingles. If you've heard of shingles, you might know it as a painful skin rash, but there's much more to it than that. In this video we'll take an in-depth look at what shingles is, what causes it, how it presents, how it's diagnosed, what other conditions it can mimic, and how it's treated. Whether you've been diagnosed with shingles, are concerned about your symptoms, or simply want to know how to recognize and manage this condition, this video will help. Let's get started. Shingles, also known medically as herpes zoster, is caused by the reactivation of the varicella zoster virus, the same virus that causes chickenpox. When a person gets chickenpox, usually during childhood, the virus doesn't completely leave the body. Instead, it remains dormant in nerve tissues, specifically in the dorsal root ganglia near the spinal cord. For most people, the virus stays inactive for decades, but in some, it can reactivate later in life. When it does, it travels along nerve pathways to the skin, causing the painful and blistering rash that we recognize as shingles. The exact reason why the virus reactivates in some people and not others isn't always clear. However, there are known risk factors. Aging is the most significant one, with shingles being much more common in people over the age of 50. A weakened immune system is another major contributor. This can be due to medical conditions like cancer, HIV, or autoimmune diseases, or due to medications like chemotherapy, steroids, or immunosuppressants used after organ transplants. Even extreme stress can sometimes suppress immune function enough to trigger an outbreak. Let's now talk about the symptoms of shingles and how the condition unfolds. The first signs of shingles are usually nonspecific. People often begin by experiencing pain, tingling, burning, or itching in a localized area of the skin. This discomfort usually occurs on one side of the body and follows the path of a nerve. It often appears on the chest, back, or abdomen, but can also affect the face, eyes, or even genitals. This early stage can last for a few days before any rash becomes visible. After this initial phase, a red rash typically appears in the same area where the pain started. Soon after, clusters of small fluid-filled blisters develop. These blisters resemble those seen in chickenpox, but are typically confined to a narrow strip or patch of skin. They may continue to appear for several days, eventually breaking open, crusting over, then slowly healing. This entire process usually lasts between 2 to 4 weeks. During the rash phase, patients may feel tired, feverish, or just generally unwell. Swollen lymph nodes near the rash may also occur. The pain during a shingles outbreak can be intense and is often described as burning, stabbing, or throbbing. For some people, this discomfort is mild. For others, it can be debilitating. When shingles affects the face, it can involve nerves that control vision and hearing. If the virus affects the ophthalmic branch of the trigeminal nerve, it can lead to herpes zoster ophthalmicus, a serious condition that may cause vision loss if not treated promptly. If the ear is involved, as in Ramsay-Hunt syndrome, it can lead to facial paralysis and hearing problems. So how is shingles diagnosed? In many cases, the diagnosis of shingles is made based on the patient's history and the appearance of the rash. A doctor will ask about symptoms such as pain, the location and pattern of the rash, and whether the patient has had chickenpox or received the shingles vaccine. The classic appearance of grouped blisters in a band-like distribution on one side of the body is usually enough to confirm the diagnosis. In some situations, especially if the rash has an unusual appearance or if diagnosis is uncertain, laboratory tests may be used. A sample from a blister can be tested using PCR assay to detect varicella zoster virus DNA. This is a highly accurate method. Viral culture or direct fluorescent antibody tests may also be used, though they are less sensitive than PCR. Blood tests aren't typically used to diagnose active shingles, but they may be ordered if the doctor suspects another condition or wants to assess the patient's immune status. Now let's look at the differential diagnosis. In other words, what else could be causing similar symptoms? Several conditions can resemble shingles, especially during the early stages before blisters develop. One of the most common is herpes simplex virus, which can cause localized painful blisters that may be mistaken for shingles. However, herpes simplex outbreaks tend to recur at the same locations and often affect the mouth or genitals. Contact dermatitis, an allergic reaction to substances like poison ivy, chemicals, or detergents, can cause red, itchy rashes and blisters that resemble shingles. But contact dermatitis is usually more itchy than painful and does not follow a specific nerve pattern. Another possibility is insect bites, particularly if they blister or become infected. Bacterial skin infections like impetigo or cellulitis may also look similar but typically lack the specific nerve distribution and are usually accompanied by signs of infection like warmth, swelling, and pus. In some cases, autoimmune diseases such as lupus or dermatomyositis can cause rashes that may mimic shingles. And very rarely, metastatic cancer affecting the skin can appear as a rash or nodules, although the symptoms usually don't include the intense pain typical of shingles. So now let's move on to how shingles is treated. Prompt treatment can make a significant difference in the course of shingles, especially if started within 72 hours of the rash appearing. The mainstay of treatment is antiviral medication. Commonly used antivirals include acyclovir, valacyclovir, and famciclovir. These drugs help to reduce the severity and duration of the outbreak, and they can also lower the risk of complications like post-herpetic neuralgia, a condition we'll talk about in a moment. Antiviral medications are most effective when started early, ideally within the first 3 days of rash onset. In cases where treatment is started later, antivirals may still offer some benefit, especially if the patient is at high risk for complications or if new blisters are still appearing. Pain management is another critical part of shingles treatment. Over-the-counter pain relievers like acetaminophen or ibuprofen may help with mild to moderate discomfort. For more severe pain, prescription medications may be needed. This could include stronger painkillers, nerve pain medications like gabapentin or pregabalin, or tricyclic antidepressants, which can help nerve-related pain. Topical treatments, including lidocaine patches and capsaicin cream, may also provide some relief. In certain cases, corticosteroids are used in combination with antivirals to reduce inflammation, especially when shingles affects the eyes or causes nerve compression, but they are not routinely used in all cases. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, keeping the rash clean and dry is important to prevent secondary bacterial infections. Calamine lotion or cool compresses can help soothe irritated skin. Patients should avoid scratching or picking at blisters, and it's a good idea to keep the rash covered if possible, especially to protect others who might be vulnerable. Let's now talk about complications, especially the one most people worry about, post-herpetic neuralgia. Post-herpetic neuralgia is a condition where nerve pain continues long after the shingles rash has healed. This pain can persist for weeks, months, or even years, and may be severe. It's more common in older adults and those who experience severe acute pain during their shingles outbreak. The pain may be burning, stabbing, or feel like an electric shock. It can interfere with sleep, mood, and daily activities. Treating post-herpetic neuralgia often involves nerve pain medications such as gabapentin or pregabalin and antidepressants like amitriptyline. These medications have been shown to be very effective. Topical lidocaine patches may also provide relief. Managing this complication early and aggressively can improve quality of life significantly. Other complications of shingles can include bacterial superinfection of the skin, scarring, vision loss if the eyes are affected, and hearing or balance problems in Ramsay-Hunt syndrome. In rare cases, shingles can affect internal organs or lead to complications like pneumonia, especially in people with weakened immune systems. Let's end it by talking about prevention. One of the most effective ways to prevent shingles is through vaccination. The shingles vaccine, known as Shingrix, is recommended for adults aged 50 and older, even if they've had shingles in the past. It's also recommended for people age 19 and older who have weakened immune systems due to certain health conditions or medications. Shingrix is a 2-dose vaccine that provides strong and long-lasting protection against both shingles and post-herpetic neuralgia. Getting vaccinated not only helps protect you from the pain and discomfort of shingles, but also reduces the likelihood of developing serious complications. For those who've already had shingles, the good news is that it usually doesn't return. However, in some people, especially those with compromised immune systems, recurrences are possible. In summary, shingles is a common but potentially serious condition caused by the reactivation of the chickenpox virus. It begins with pain or tingling in a specific area, followed by a blistering rash that lasts for several weeks. Early diagnosis and treatment with antiviral medications can shorten the illness and reduce complications. Recognizing the symptoms and understanding how it differs from other conditions are key steps in getting appropriate care. And for those eligible, the shingles vaccine offers powerful protection and peace of mind. Thank you for watching. As always, take care of yourself and make the most of your day.